Remember when we are discussing about the development of lung, we have discussed about the maturation of lungs. How many stages are there in the maturation of lungs? 4 stages, right? What are those? The first question is related to your maturation of the lungs. Go check the stages and find out the reason or the embryological basis for the difficulty in the breathing of the newborn baby. Okay, we'll go to the second question. At birth, a baby girl has meconomia in her vagina and no anal opening. What type of birth defect does she have and what was its embryological? There is no anal opening in the second condition or in the second question, and they have mentioned one more condition as meconia. What do you mean by that? So if there is no presence of your anal opening, if it is blocked or if it is completely absent, what that condition, you can sit. What that condition is called? Meconium is nothing but the first poop of the baby. For that we use or we referred a word called meconium. So after birth, a baby girl has meconium, that means she had her first poop in the vaginal region because there is no anal opening. So you have to find out what birth defect it is and what is the embryological basis for that condition. Okay, you have to write the assignment and come, then only I am going to give the answers. You can cross check by yourself after that. Okay, next go for third question. So what do you mean by tracheoesophageal fistula? Trachea and esophagus are not separated. Okay, what is the embryological basis then? No idea. They asked the what is most common type of TEF. So how many types of TEF we can see? In general, how many types are there? And what is the most common type? 5 types. What are those? Can you name at least any one type? The question is very clear. You just have to write a note about tracheoesophageal fistula, then you have to mention the most common type. Also you should know how many different types are there and what are the embryological basis for those types. Okay, next question. It is related to your respiratory system only, development of respiratory system. Again the question is related to the maturation of lungs part only. Okay, in the first question they have given after the 6th month of gestation the baby is having trouble with the breathing. So there is, okay, this first question and fourth questions are related. If you check the maturation of lungs, tabular column is there, no, which I have discussed. If you see that, it has given which stage is going to happen in which weeks. Related to that you can see the embryological basis also. Okay, you need to check that. We'll go to the next question. So cyanosis is a condition where the baby's face turns into blue color when he or she cries. So what is the embryological basis? Which chapter it is related? Again, respiratory. Sure. How? It is related to nerve supply of lungs. Okay. Any other answers? His answer is it is related to respiratory system because the nerve supply of lung. It is related to that part. Any other answers? So what do you all understood by the question? First question, it is related to GIT. Okay, fine. I am asking what you understood by the question. It's right, it is related to your GIT only. When you read the clinical questions, you should be able to analyze or say about the question in your own words also. Marked distension in epigastric region, fine. So it is related to your GIT. Which part? You said, you mentioned about atresia, right? Okay. Duodenal atresia, okay. What is going to happen in duodenal atresia? What is the embryological basis for that particular condition? Fine, we'll go to the next question. Next question. First tell me what you all are getting through the question. What is the condition or what exactly happening? So give its embryological basis. Do you know any condition where you can see the intestinal part coming out of the umbilicus? Intestine. So it is related to your midgut part. Do you remember the physiological hernia part in the midgut? When we are discussing the development, I said there is three steps to remember the development. The first one is herniation, second one rotation, and the third one is fixation, right? So what is going to happen in the herniation part? There is no enough space in your abdominal cavity due to the enlargement of the liver and also the rotation of your stomach. So the intestine part will come out of the abdominal cavity as a U-shaped loop, right? I said it come out of your abdominal cavity through the umbilical opening. Do you remember this? So after certain changes or during the process of development, again it will go back to your abdominal cavity during the process of second rotation. So if that condition or if that process does not happen and the intestinal part remain outside the abdominal cavity, we call it as even after the completion of development. There is two conditions. The one is amphalocele and the another one is gastroschisis. Remember anything about these two conditions? Amphalocele is a condition where you can see the intestinal part outside the body covered by a thin transparent membrane. Gastroschisis is a condition where you can see the intestinal part outside the body but it is not covered by any membrane, and it is more right side, it is more related or it is more towards the right side of your body. That is called gastroschisis. So which condition we can see here? Amphalocele or gastroschisis or any other condition? Okay, fine. So again it is related to your respiratory system question. Can you analyze the embryological basis? Stages of? Okay, fine. So how many stages are there? 4 stages. Can you name them? Okay. Okay. That's it. What about the other 2 stages? And they even added the question, what is the most likely diagnosis? You have to write note on that part also. If you know how many stages are there, what are the stages and what are the developmental changes we are going to see in those 4 stages, you can answer all these questions. That's it. What do you mean by hernia? How many types are there in hernia? 2 types. What are those? Direct, indirect. So what do you mean by direct hernia and what do you mean by indirect hernia? How do you differentiate those 2 types of hernia? What do you mean by inguinal hernia? What are the other types of hernia we can see in the body? Femoral hernia, heard of it? What do you mean by that? What are the other types of hernia we can see in body other than inguinal and femoral hernia? Is there any other types? Fine. Okay. What did you understood by this question? Okay. It is related to the? Fine. And they are asking, mention whether or not congenital indirect inguinal hernia can occur in females. It cannot be. Okay, why? Okay, fine. So what kind of hernia we see in females? If we cannot see the inguinal hernia, what type of hernia we usually or commonly seen in women? Femoral hernia. Okay, fine. Any other answers? Okay, we'll go to the next question then. Next question, please. So what is happening in the second case? There is no development of, what is it?
The baby might not develop stomach.
Okay. Okay. So it is related to GIT. Okay, fine. Any other answers? When inquired about antenatal history, it was found about to be a case of polyhydramnios. What do you mean by polyhydramnios? Amniotic fluid is disorder. Amniotic fluid disorder. Okay, fine. What happens when there is a amniotic fluid disorder, or what exactly is that? He ordered for an X-ray chest which shows the absence of stomach bubble. Yeah, we have discussed about the double bubble condition, if you remember, in the developmental anomalies of the stomach. Do you remember? When I have added the picture of X-ray also. In that X-ray you can clearly see the empty or bubble like space in your abdomen region of that particular area. So is it related to your GIT? Yes. Which part? We have hindgut, midgut and foregut, right? Midgut. Okay, in midgut it is related to development of stomach. So stomach is developed from midgut. Your esophagus part and the stomach is developed from foregut, and also a part of proximal part of duodenum. Distal part of duodenum, intestine, small intestine part, and your cecum appendix is developed from the loop, that is midgut. And from the hindgut we have rectum and anal canal, right? So if it is related to midgut, and again you are telling it is related to the development of stomach. Okay, it is related to developmental anomaly of stomach. Fine. Any embryological basis? Anything you can remember? Whatever you know you can discuss, no problem. First you should know what is exactly polyhydramnios means. Said it is related to amniotic fluid or cavity. Yes, it is right. But what exactly is that you should know. Along with the fetus. Okay. Any other answers? Polyhydramnios means the presence of excess amniotic fluid. Okay. Presence of excess amniotic fluid around the developing fetus. Can you analyze the question now? Okay, we'll go to the next question. Give the embryological explanation for the given figure. So which chapter it is related to? Respiratory. Fine. Any other answers? Development of heart. Okay. So can you see the picture and tell me what exactly or what are the structures you can identify in that? Okay. Arteries and the upper respiratory tract. Okay. Any other things you have noticed? Development of aortic. It is related to the development of aortic arch. Okay. Any other answers? If the figure is given with the embryological explanation, or if they are asking you to write the embryological explanation, definitely there is some anomaly. Okay. So can you figure out where exactly the problem you can see, or what's wrong in the figure? It's not piercing actually. The dotted line you are talking, right? This part you are talking, right? Piercing means, or which part? This part or this part or this part? Which one? Here, this one? In front of the? This one. Okay. This is not piercing. Okay, at this stage there should be no presence of right aortic arch. Fine. Any other answers? So any embryological explanation for that figure? Anybody? How many aortic arches present in our body generally? We have both like right and left aortic arch. Only one. Which side? Right side or left side? Left side. Okay. So it is developed from which part? Aortic arch. Okay, we have one aortic arch in the body and it is present on left side. So it should develop from certain part, right? During the development. From the left ventricle. Remember the aortic arch structure? I mentioned there are 6 aortic arches. Among 6 aortic arches, the first, second and fifth will disappear. We will remain only with the second, third, fourth and sixth aortic arches. From that third, fourth and sixth part, we are going to get other arteries like common carotid artery, aortic arches, descending aorta, ascending aorta, all these parts, right? So from which pharyngeal arch artery your aortic arch is developing? From the third or from the fourth or from the sixth one? Sixth. Which side? Right side or left side again? Only in the third aortic arch the structures are similar on both right and left. In the fourth and sixth one, the structures in the right side and the structures present on the left side are completely different, if you remember what we have discussed. So if it is developing from the sixth aortic arch, which side? Right side or left side? Are you sure it is developing from the sixth aortic arch only? That too from the left side? Okay, in this picture you can see the presence of 2 aortic arches. We have right aortic arch and left aortic arch. That means it is the condition of double aortic arches. It is also a developmental anomaly. Okay, if you remember, I have given the assignment for double IVC also, double inferior vena cava. I have added only the heading in my PPT and I said write the assignment question or write note on the double IVC. In the same way I have discussed double aortic arches also. So what did you understood by the question at least? They are just asking you to observe the figure A and B and give the embryological explanation for the multiple congenital anomalies that is occurring. In the figure they have already mentioned what are all the conditions. You can see that they have mentioned about the amphelocele, they have mentioned about the imperforated anus, clubfoot, meningocele and scoliosis. They have already given, you just have to write the note about those conditions. But I am asking what did you understood by the question? What do you mean by gravida? What do you mean by crown rump length? Is this the very first time you are seeing those words or you have heard before? Is this the first time? Say yes or no. Yes. Okay, fine. No problem. Can you see the figure A and B? Can you see the conditions what they have mentioned? Do you know any condition and its embryological basis? We'll start from the figure A. Hope you know what is amphelocele means, right? Just now I have mentioned about 2 conditions, that is amphelocele and gastroschisis in the development of midgut or the anomaly from the midgut. Amphelocele is a condition where the intestinal parts are coming out of your umbilicus region and covered by a thin membrane. Gastroschisis is also the same condition, but it is not covered by any thin membrane and those contents will be more to the right side of the body. I think just 10 minutes before I have only mentioned. Next we have imperforated anus. Again in the class I have told you guys to write the assignment on imperforated anus, right? So what do you mean by imperforated anus? Anal opening is not there. Okay. So now tell me what is happening in the second question. What you can analyze. So we have a girl baby where we can see the poop present in the vaginal region and there is no anal opening. That means if there is no anal opening, that particular condition is called imperforated anus. Next the question is what type of birth defect does she have and what was its embryological origin? If there is no opening in the anal, your poop is happening in the vaginal region. What it is called? Okay, so that particular condition is called meconius. It is related to your development of hindgut, rectum and anal canal again. Okay, go see in the textbook and answer. Next we have clubfoot. What do you mean by clubfoot? What is the embryological basis for the clubfoot? I hope lower limb part is completed, right? Upper limb, lower limb is finished. Yes or no? Yes. Then what do you mean by clubfoot? Medial okay. The feet are medially rotated. Any other answers? What do you mean by meningocele? B figure, posterior view. Or in which region we can see the meningocele condition? It is related to which part? Which part of the body? The last condition is scoliosis. What do you mean by scoliosis? Again, it is related to which part of the body? Large intestine. Scoliosis. Which one? Meningocele or scoliosis? Okay, in this question find out what exactly gravida means and then find out what is crown rump length. Okay, then in given condition they are asking you to do the observation and write the embryological explanation for all the given condition, but here you just write a note for amphelocele and imperforated anus. Okay, fine, because other parts are not related to the topics which I have covered. So go for amphelocele and imperforated anus. Along with these two conditions, find out what is gravida means and find out what exactly is crown rump length and how do we measure that. Here they have given 20 centimeter, so it should be measured, right? So how exactly we measure the CRL? You have to find out that. Okay. A baby born at 6 months of gestation develops a condition called respiratory distress syndrome and it will die. So what is the embryological basis? See the first question here. Is it the same question or different? Same. Okay. So what do you mean by respiratory distress syndrome? Difficulty in breathing. Okay, fine. Any other answers? What is the reason behind having difficulty in breathing in a newborn baby? Okay, fine. Which stage again? There are 4 stages. So in which stage there is a problem or in which stage we can see the particular syndrome? Okay, the very first question and this question is pretty similar. Find out the embryological basis. Okay, we'll go to the next question. So you have to find out what exactly is respiratory distress syndrome and what its embryological basis and also the therapy used to prevent this particular syndrome. Okay, it is clearly given in your textbook. Go and read, and also in the next session I am covering the developmental anomalies of the respiratory system. We haven't discussed that yet. If you try to see in your study by yourself once and if you answer these questions, it will become more easy. We can discuss. Hardly it will take 15 to 20 minutes. That's it. Next question please. They are mentioning the baby is having problem with the difficulty also, and they have taken the radiograph of the stomach region also. So what is the embryological basis for this condition? What exactly happened? So what that condition is called if it is not separated? In general I am asking, not related to this question. Okay, fine. So how you will relate that into this question? They are asking what is the most likely diagnosis. How do you diagnose that condition? Any idea? That is given in the question only, no, already. What is the most likely diagnosis? That means how you will treat that condition, right? Diagnosis means? What do you mean by the word diagnosis? Okay, fine. Any other answers? Fine, we'll go to the next question. Next question.
Baby was born at 26 without gestation and was having difficulty to breathe. Can you explain the biological basis for this condition and how this baby can be treated?
Again, this question is related to your respiratory system only. Okay. Next question.
On chest Tripura, shadows of lungs of a newborn infant are denser than those of adults. Why?
Sit. What did you understand? Stop talking, both of you. What is there to laugh? Answer the second question, both of you. Discuss now and answer. Get up. Get up, both of you. Tell me what is happening in the second question. They are telling the lung of a newborn baby is denser than those of adults. What do you mean by denser? So in adults we have less density and in infants there is more density. Okay, fine. Any other answers? Is that a normal condition or is it any anomaly? Normal condition only. Okay, fine. Any other answers? Any other answers? What if it is not denser in infants compared to the adults? You said in adults it is less denser, right? Less density will be there, but in infant it is more. That's what you said, right? What if in infants, if it has less density than the adults? Is that possible? No. Okay. Okay. Any other answers? Others? Stop using your phone. Keep it inside. Any other answers? No? Okay, we'll go to the next question. Next question. Fine. So what is the embryological basis for this condition? So what exactly we can happening here? What is the condition first before going into the embryological basis? Any answers? Okay, fine. What is the embryological basis for this condition? At least try to answer that directly. Developmental anomaly of right lung. Okay. Bronchus also. Fine. Any other answers? No? Do you know any developmental anomaly of bronchus? Do you know any particular condition? No. Okay. Others? In your thoracic region and abdominal region there is a separation, right? Yes or no? Yes. How? What is the separation is present, or which structure we can see between your thoracic diaphragm? So here they are telling the right lung was found in the abdominal cavity. If there is a diaphragm to separate between the thoracic region and abdominal cavity, how your right lung is entering into your abdominal cavity? Okay, there is anomaly in your diaphragm also, then in your diaphragm is absent. Okay. Any particular name for that condition? Is it possible? He is telling maybe right. Maybe the diaphragm is absent. So is it possible? Yes or no? Yes. Okay. What is the embryological basis then? So if you remember, I have written principal bronchus, from that right principal bronchus, left principal bronchus, and with that only I have written the continuation of the lung bud, right, with attachment only I have written. But here they have given the blind diverticulum, that means there is no attachment between your right principal bronchus and not with the left, with the right bud, right lung bud. It will remain only as a small part If you remember the Meckel's diverticulum, do you remember? No? You got it what I have said?
Yes, I'll see whatever explained, I'll see.
Okay, fine. So that's all about the clinical problems or questions. You have to write assignments for the clinical questions and also for the MCQs. Okay, once you all complete your assignments, then I'll give the answers. Okay, next we have few review questions. Write a short note on tracheoesophageal fistula. What are the stages in the rotation of gut? So what are the stages we can see in the rotation of gut? Tracheoesophageal fistula you are going to write in your clinical problems only, so I am not discussing it here. What are the stages we see in the rotation of gut? While studying the gut region, we have three gut parts, right? Foregut, midgut and hindgut. So in how many gut region the rotation is taking place, and what are those rotation? Okay, next question. Explain the development of duodenum. You have to write both the parts, proximal part development also, distal part development also. Fine, we'll go to the next question. Name the derivatives of foregut, midgut and hindgut. So what are the derivatives of these three guts? Foregut, esophagus, stomach. Any other derivative? Proximal part of duodenum. Okay. Any other parts? Derivatives of midgut? Distal part of duodenum, small intestine, appendix, transverse colon. Which part of transverse colon or the complete transverse colon? Which part? Others? Derivative of hindgut? Derivatives of hindgut? Rectum, anal canal, ascending, descending colon, sigmoid colon and transverse colon. Again, which part of transverse colon? Distal, proximal. Okay. Next question. Write a note on primitive urogenital sinus. What is primitive urogenital sinus? What are the parts of primitive urogenital sinus? What are the derivatives of primitive urogenital sinus? Which part of our body is going to develop from the urogenital sinus? Urogenital organs. Okay, fine. What are the parts of urogenital sinus? At least tell me how many parts we divide into. 2, 3, 4, 5, like that. How many parts are there? Forget about the names, just tell me how many parts are there in urogenital sinus, or how do we divide the parts. Okay, next question. Explain the development of urinary bladder. How the urinary bladder development takes place? So the development of urinary bladder is same in male and females? Yes or no? Is the development of urinary bladder same in male and female? Yes? Yes or no? Yes. Okay. From which part the urinary bladder is going to develop? Explain the development of male and female urethra. Is it the same? The development of male and urethra similar? Is it similar? No. So what are all the changes you see? Or what are all the development differentiations we can see? How your male urethra is going to develop? How many parts are there in male urethra? Gross structure. In gross structure I am asking, not in the forget about the development. Tell me the general features of male urethra. What about female urethra? General features, not development. Difference between male and female urethra. Okay. 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 Openings. Okay. And prostate gland, gallbladder gland that present in males. Okay. What about females? How the development takes place? We'll go to the next question. Describe descent of testes. How the descent of testes takes place? In which week this event is going to happen? 35th week. Okay. What do you mean by descent of testes then? From abdominal to scrotum. Okay, fine. How the process takes place? There should be some support present to your testes, right? To descend from your abdominal region to the scrotum region. Presence of tube. Is there any particular name for the duct or tube? Yes? You don't remember. Okay. Any other answers? We'll go to the next question. Write a short note on Meckel's diverticulum. While discussing also at that day I mentioned it is an important question. Meckel's diverticulum. Even if you get intestine for your discussion also, like practical discussion, definitely they'll ask you what is Meckel's diverticulum. You need to give the embryological basis for that question and then you have to discuss. Ductus arteriosus, which chapter? I have added questions only from the part which I have discussed. So at least you can take a guess. Development of heart. Okay. So where you can see the ductus arteriosus. Again in the development of heart we have three parts. Development of heart tube, development of your pharyngeal arches and development of your venous system. Which part? Arches. Okay. What do you mean by ductus arteriosus then? Ductus arteriosus, again you will get questions for MCQs also. Okay. Next, the development of inferior vena cava. How many parts are there in inferior vena cava? How many segments? Segments are there in inferior vena cava? How many components are involved in the development of inferior vena cava? For the development of your inferior vena cava, 6 components are involved. For the development of your superior vena cava, only 2 components are involved. So what are those components? And your inferior vena cava have 4 segments, where your superior vena cava have 2 segments. Can you name the 4 segments, anyone? Okay, tell me how the development of inferior vena cava takes place. It starts from which week? Okay. Next question. Describe fetal circulation. How the fetal circulation takes place. Fetal circulation, remember, if you are writing answer, you have to write it with diagram. If you write only the theory part, you will get no marks for that. Absolute 0. First you have to draw the diagram, you have to show the arrow marks from where to where the blood circulation is taking place, then you have to write the theory part. Okay. If you are attempting that question, remember these points. First always draw the diagram. For any developmental questions, go for diagram first. Okay. Show the arrows properly from where to where the changes is taking place or from where to where the circulation is happening. Then write the theory part. You can write the theory part later in your own words also. Fine. So how the fetal circulation takes place? So in fetus, how the purification of blood takes place? What is the source for purification of blood in fetus? What is the main reason behind the fetal circulation? At least ultimately which part it will supply? Tell me that. The oxygenated blood will reach from which part to which part in fetal circulation? Okay, in adults? In general. Where the purification of blood takes place in adults? Lungs. Okay. So the purified blood from the lungs, it will come to left atrium, and from left atrium? Left aorta. Okay. From left atrium to left ventricle. Okay. Then from left ventricle to aorta. Okay. Then from aorta to other parts of the body. Okay. Fine. So how the fetal circulation is taking place? From which part? It's in adults, it is starting from the lungs and it is going into your atrium, then ventricle, then to the other parts of the body, right? Exactly, tell me in the fetal circulation. Where the purification of blood takes place in the fetus first? Placenta of the mother. Okay. From there it is reaching into which part? From placenta of the mother, the purification of blood takes place, and from the left umbilicus vein, it is going into your inferior vena cava, and from the inferior vena cava, it is entering into your right atrium, then to the left atrium, then followed by left ventricle, and from that left ventricle through the aorta, it is going into your developing brain. What is surfactant? How does it reduces the surface tension of the alveoli to prevent their collapse? Tell me what is surfactant first. And what is surface tension in your alveoli to prevent the collapse or expanding of your lungs? Only the alveoli.
Surfactant for
Okay, fine, fine. Any other answers? Surfactant is a fluid layer. We'll go to the next question. What is the embryological basis for difference in innervation of mucosa and muscles of larynx by different nerves? What are the points we discussed when we are studying the development of larynx? What is the source for development of your respiratory system? Your larynx, trachea, bronchus and your lungs develop from which part? Respiratory diverticulum, right? How the development of larynx happens? Tell me that first. If you remember, while discussing about the development of larynx, on the board I have written epithelium, muscle and cartilage, nerve supply and blood supply. So your epithelium is derived from endoderm part, muscles and cartilage are derived from the 4th and 6th pharyngeal arch. Nerve supply is by vagus nerve, right? In the vagus nerve, there are two types of nerve that supplies to your larynx. The one is superior laryngeal nerve and the another one is recurrent laryngeal nerve. They are asking what is the embryological basis for the different innervation of the larynx. I already mentioned superior laryngeal nerve and recurrent laryngeal nerve. Two different types of nerves are supplying to your larynx region. So what is the embryological basis for that? Fine, we'll go to the next question. Explain the development of larynx, and next we have the stages in the maturation of lung. Development of arch of aorta, again the note on primitive urogenital sinus, development of urinary bladder, male urethra and female urethra. MCQs. You can read the question, see the options, discuss among yourself and tell me the answer, and you have to tell me the reasons also. First question answer, which option? All arteries supply primitive gut except median sacral artery. What is the reason? What is the reason behind choosing the D option? Okay, fine. Second question. First tell me where you can see the buccopharyngeal membrane. It is related to your GIT. So where you can see the buccopharyngeal membrane? At least take a guess and tell me the answer. Okay, like you are telling the buccopharyngeal membrane is present between the buccal cavity and pharynx, right? 5th week, 8th week, okay, fine. Any other answers? First question, tell me what is cloacal membrane? Where we can see the cloacal membrane? If you remember the development of anal canal, upper part will develop from the cloaca and the lower part will develop from the proctodium. Remember that point? Yes or no? So between that cloaca and the proctodium we have a membrane called cloacal membrane. During the development process, either it will rupture or disappears. That will help in the communication or connection between your cloaca and the proctodium. The upper part will develop from the cloaca and the lower part of anal canal is going to develop from the proctodium. So tell me in which week the rupture is taking place. All are derivatives of the midgut except C, left 1/3 of transverse colon. Okay, so your left 1/3 develops from hindgut. What about the other part of transverse colon? It's from the midgut. So which part? Right 2/3 of transfer. Okay, fine. Next question. Okay. What do you mean by physiological hernia of midgut loop? You said it can also happen in males, right? Okay. So what do you mean by physiological hernia of midgut loop? You should know what exactly Meckel's diverticulum, what is the embryological basis, and what are all the factors that affect this particular condition to answer this MCQ. We'll go to the next question. Second question. Which option? You can take a guess and answer, it's fine. All are true about midgut rotation except total anti-clockwise rotation is 270. Is it true? First tell me what are all the points you know about midgut rotation. How many rotation takes place in midgut? Remember I mentioned there will be 3 rotation in 90 degree and all 3 rotation takes place in anti-clockwise direction. The first one happens outside the abdominal cavity, second and third rotation takes place inside the abdominal cavity. Remember these points? Yes or no? Yes. Then what is the answer for second question? Option D. Non-rotation may cause gastroschisis. All are true about midgut rotation except non-rotation may. So what causes gastroschisis exactly?
All 3 points are correct.
Okay.
I don't have idea about this last.
Okay, fine. So it's more like a guess. Okay. Others? What do you mean by congenital megacolon? Is it a developmental anomaly? Which option for first question? All are derivatives of foregut except pancreas. If it is not developing from the foregut, from which part it is developing? Pancreas? Midgut. Okay. How the development of pancreas is taking place from midgut? Any other answers except D? Shall we go to the next question? First sign of development of the respiratory system is the development of respiratory diverticulum. Okay. Where you can see the presence of respiratory diverticulum? Any other answers other than C? Where you can see the development of respiratory diverticulum? D. All are true about surfactant except it is produced by type 1 alveolar epithelial cells, that is type 1 pneumocytes. Okay. Any particular reason behind choosing that? Okay. Surfactants are produced by type 2, not from type A, I mean type 1. Okay, fine. Any other answers? What do you mean by blood-air barrier? The part where?
The part to which the exchange takes place.
Exchange of gases takes place. Okay, fine. Blood and air barrier. Any other answers? Which option? B. Blood-air barrier in the lung consists of mesoderm only. Okay, any other options? Any reason behind choosing B? Okay, next question. Regarding respiratory diverticulum, all are correct except it is mesodermal in origin. Okay, any other answers? B. All are correct except it appears when embryo is about 4 weeks old. Okay, if it doesn't appear on 4th week, when it is going to appear? In which week? And what is the reason behind choosing C? You thought A, B and D are correct, so C is wrong. Okay, any other answers? A. It is an outgrowth of the ventral wall of foregut. Okay, any explanation for that? It develops from the diverticulum. It develops from the median diverticulum. That median diverticulum should be present on one aspect, right? Either on ventral aspect or dorsal aspect, or in the anterior or posterior aspect. So that might be the ventral aspect. Any other answers? D. Select the incorrect statement about the development of lung. Respiratory bronchioles are formed during the canalicular stage of lung maturation. So if it is not correct, when the respiratory bronchioles will form, in which stage? If it is not in the pseudogangular stage. Okay, fine. So D is the correct option. Any other answers? Okay, second question. The stage of maturation of the lung that extends from 16th to 26th week is called canalicular stage. So when the pseudogangular stage takes place? 5th to 16th week, then from 16th to 26th canalicular, and the terminal sac stage is from after 26th week. Okay, and then what about the alveolar stage? It is the first stage. Okay, which is the first stage in these four? Pseudoganglia, followed by canalicular, for terminal sac only, then alveolar. Okay. Option D. So from 16th to 26th week, that stage is called alveolar stage. Okay. Any other answers? Stop using your phones. Any other answers? Next question. Next questions. Which option for first question? B. All laryngeal cartilages develop from neural crest mesenchyme of 4th and 6th pharyngeal arches except thyroid cartilage. Any other answers? Epiglottis. So your epiglottis developed from? And what about the thyroid cartilage? Epiglottis developed from? Meso?
Except epiglottis, all the three develops from mesocardium.
Okay, I got it. I am asking from which part your epiglottis developing then? And what about you? Thyroid cartilage. If it is not developing from your 4th and 6th pharyngeal arches, it is developing from which part? Any other answers? No? Okay, next question. All are features of alveolar stage of lung maturation except type 1 pneumocyte secrete surfactant. Okay. Any other answers? You choose that because surfactant are produced by type 2 pneumocytes, right? Is that the reason? Okay, any other answers? First one? Option B. All are true about aortic arch arteries except they are numbered as first, second, third, fourth and fifth. Okay, any other answers? Fine, second question. That is arch of aorta. Which option? Arch of aorta does not develop. Forget about does not develop from. Tell me, arch of aorta develops from. Your arch of aorta develops from. It's developed from the left horn of aortic sac. Okay, fine. Any other answers? You are telling arch of aorta does not develop from. It develops from. Okay. Any other answers from it develops? It develops from the ventral part of aortic sac. Okay. So which part it doesn't develop from? Left 7th intersegmental artery. What about you? So your arch of aorta is developing from ventral part, left horn and left 4th aortic arch, but not from left 7th intersegmental artery, right? Any other answers? Option C. It is not developing from left 4th aortic arch artery. Okay. Any explanation for that? Left 4th aortic arch artery disappears. It degenerates. Okay. You want to add any other points? No. Okay, fine. Others? While writing your assignments for MCQ, along with choosing the option, you have to give the reasons. With reason, you have to write it. Okay? Thank you.